Good morning, Peter Goertz. I'm a psychiatrist. How to enjoy being a psychiatrist? Is that a paradoxical issue, potentially? I don't think so. What I tell medical students and residents when I first meet with them before a rotation is the top priority is safety, so safety of yourself, safety of the patient. But then right after that, the next priority, in my opinion, is enjoying yourself, enjoying your work as a medical student, as a resident, and as a psychiatrist, of course. And enjoying yourself is, of course, important because of the duration of your career. You're going to be a psychiatrist for maybe 40 years. And patients pick up on whether or not you enjoy your work. And that, of course, affects the relationship with patients. And in fact, the relationship with patients is very important. And I'm trying to remember, there was a study done that I heard about not that long ago where some patients had psychiatrists who tended not to have a very productive relationship with patients. Some patients had a psychiatrist whom patients tended to have a good relationship with. And when the psychiatrists who tended to have good relationships with patients gave patients placebos, they had a pretty high rate of response, the patients, to placebo, probably related to having a good relationship with the psychiatrist. So very interesting. Even active antidepressant, if it was prescribed by a psychiatrist who did not have a very good relationship with patients, tended not to do that well. So not to do very well. So very interesting. The relationship with the patients, with the between psychiatrist and patient is key. In order to be able to enjoy yourself as a psychiatrist, you need to have curiosity about people, and if at all possible, about the entire range of human experience. You're going to hear about terrible things, all kinds of abuse, conflict. And it's important, in my opinion, to be willing to give emotionally to people who are in distress often when you see them. And you want to develop your own style. So each person has their own style. What works for you may well not work for me, and vice versa. So one thing that works well for me is humor. I enjoy laughing. Patients, on average, tend to enjoy laughing. And what I've found over the years is you can pretty much say almost anything to patients if you are coming from a good place. And if you say something humorous and it's coming from a good place, generally, in my experience, the response of patients has been good. How to deal with potential stress as a psychiatrist. You're going to be exposed to potential verbal abuse, physical assault, even potentially supervisors telling you to do things that you don't enjoy, that you don't feel are ethical even maybe. You're going to be asked to treat patients against their will, lock up patients in a hospital, make sure that they get their medicine even over their objection. So that can be stressful if you don't like coercive treatment, and I don't know if anyone really does. I certainly don't enjoy forcing patients to take medicine or forcing them to be in a locked psychiatric ward. However, often I don't know an alternative. So if you're a psychiatrist long enough, you're gonna more than likely have patients commit suicide. And that's a major topic in itself, but that's, of course, an additional potential stress of being a psychiatrist. And time can be a major issue. You're going to have limited time to see patients. One general thing that I've found is helpful, and what I'm doing today is not a comprehensive discussion of how to enjoy being a psychiatrist, just some ideas, some thoughts that came to me today. One general thing that helps me a lot in day-to-day work is centering myself. Getting out of your head into your body, even just for a few seconds on and off during the day, that can help ground you and help you to make good decisions and to do well as a psychiatrist and enjoy yourself as a psychiatrist. So how to center yourself, there are different techniques. Breathing can help. Just focusing on your body. Again, getting out of your head into your body can be very helpful in my opinion. And you can also re-look at things. So if a borderline patient is standing in the hallway of a psychiatric ward shouting at you, screaming at you, being verbally abusive, and patients can often pinpoint your vulnerable spots, so they may push your buttons where you're tempted to lose your temper. So one thing that helps me is to try and remind myself that situations like that, and maybe especially situations like that, are a great opportunity to learn. And another opportunity to learn would be if a supervisor is being disrespectful to you, demeaning. And I'm not saying that in a sarcastic way. I do think these situations are good opportunities to learn. And they can be opportunities for you and me, of course, to set boundaries, but to do it in a kind way. That to me is important, to interact with people, not just patients, but with staff in a kind way. And over the years, I've probably had more difficulty interacting with staff than with patients on average. Honesty, in my opinion, can help a lot. And if a patient on a locked psychiatric ward wants to be discharged and you say, no, I don't think you're ready. Of course, you want to make sure you're safe. If you feel the patient's going to be assaultive, make sure someone else is with you when you talk to the patient and tell them you don't think they're ready for discharge. In an outpatient setting, a potential point could be a patient really wants to be prescribed Adderall. You don't think that's appropriate. You want to let them know honestly. And in the moment, they may be angry, but overall, looking back, I think patients have appreciated honesty from me in the long run. You want to have good knowledge and study regularly as a resident and later on as a staff member, as a psychiatrist. And that can help you to relax, knowing that you have a reasonably good knowledge base, and then focus on what's at hand. If you're not sure about certain things knowledge-wise, that can waste time and make you insecure and can interfere with your relationships with patients. And of course, knowledge, there's an enormous amount of factual knowledge potentially to know in psychiatry and in medicine in general. You're not going to know everything. But to do your best and study regularly, I think, is important. And another thing that can help you not to burn out and to have energy to treat patients and work as a psychiatrist is delegating. And that can be a good thing. You want to delegate things to students, and often they feel good about taking on some responsibility. The same with residents. And nurses can be very helpful. You can delegate things to nurses. Thank you very much.